Today we'll be looking at breast cancer, its meaning, and the various risk factors. So call a sister, a mother, a wife, a girlfriend, a neighbor, get seated and let's get started. Breast Cancer Awareness Month in October is a month we all come together to raise awareness about the condition, promote education, we screen and early detection. Also, is an annual campaign to raise awareness about the impact of breast cancer on the lives of many, especially women. So one may ask, what is the meaning of breast cancer? Breast cancer is a cancer that forms in the cells of the breast, where cancer is a disease in which abnormal cells grow rapidly and uncontrollably and also destroy body tissue. So cancerous cells are known to be abnormal cells that invade in a cell, a tissue or an organ and destroys it completely. It also invades the surrounding tissue or organ. Now, breast cancer can occur in women and rarely in men. So it is most commonly found in women, although men can also get breast cancer. Studies have shown that the most common form of cancer that affects women is the breast cancer. The other cancer, we have the ovarian cancer, cervical cancer, but it is recorded that most women are being affected by the breast cancer. What actually causes breast cancer? The actual cause of breast cancer is unknown and is still a mystery. But studies have recorded that breast cancer is caused by a damage to a cell's DNA. And then there are risk factors that are known to predispose an individual. So now let's look at the risk factors for the breast cancer. So when we have age as a risk factor, most breast cancers are found in women who are 50 years old and above. Although there have been cases or there have been recorded cases where women with breast cancer are less than 50 years old, but getting older influences your risk for breast cancer. 2, we have family history of breast cancer. A woman's risk for breast cancer is very high if she has a mother or a sister or any family member who have had breast cancer before. So breast cancer is hereditary disease when there have been a trait or if when there have been a recorded case of breast cancer in your family, be it from your maternal side or paternal side. So if there have been a recorded case of breast cancer in your family, then your chance of getting breast cancer in future is also high. 3, we have personal history of breast cancer or certain non-cancerous breast disease. Women who have had breast cancer are more likely to get breast cancer a second time, or women who have had certain non-cancerous breast disease are more likely to get breast cancer. So if you have had a breast cancer before, or if you have had any non-cancerous breast disease before, then your chance of getting breast cancer is also high. 4, we have reproductive history. Studies have shown that starting menstrual period at age 12 and starting menopause after age 55 exposes women to hormones longer, therefore increasing their risk for getting breast cancer. So girls that start menstruation before age 12 and women that start menopause after age 55 are exposed to hormones longer, thereby increasing their risk for breast cancer. 5. We have having dense breast. There are 3 kinds of tissue in a woman's breast. 1, we have the fibrous tissue. 2, we have the glandular tissue. And 3, we have the fatty tissue. Now, dense breasts have more connective tissue than fatty tissue. Women with dense breast, that is, women who have more connective tissue, are at risk for breast cancer. We are saying that dense breast is characterized by more connective tissue than fatty tissue. So if you're a woman and you have more of the connective tissue than the fatty tissue, then your risk for breast cancer is high. So 6, we have previous treatment to radiation therapy. Women who have had radiation therapy to their chest or breast before age 30 have a higher risk of getting breast cancer later in life. If you have had any radiation therapy before the age of 30, then your risk of getting breast cancer later in life is high. 7, we have genetic mutations. Women who have inherited mutations or changes to certain genes, such as the BRCA1 and BRCA2, are at higher risk to breast cancer. The BRCA1 and BRCA2 are tumor suppressor genes, and they are important to fighting cancer. When these genes work normally, they help the breast cells, the ovarian cells, and other types of cells from growing and dividing rapidly or in an uncontrolled way. Sometimes a change or a mutation to these genes occur, which prevent them from working normally. And women who have inherited these genes are at higher risk. So these are the various risk factors that can influence an individual risk for breast cancer. Now, if you have a risk factor, it doesn't mean that you will get the disease. But if you have a breast cancer risk factors, I would advise that you go talk to your doctor or midwife about ways you can lower the risk and about screening for breast cancer. So that will be all for today's class. In our next class, we'll be looking at the cardinal signs and symptoms for breast cancer. Please, for our first-time viewers, don't forget to click on the subscribe button, turn on notification bell to be notified so you don't miss out on our subsequent classes. Also, like, share, and drop your comment, be it questions or contributions, because I'll be glad to hear from you. It's been me, your favorite midwife, Loretta, and we say Ladies Corner, our health, our priority. See you in our next class.